The dog came in on a Tuesday night, and Lena Marsh was the one who caught him before he hit the floor. She had been charting at the nurse's station when the doors burst open. Not the sliding kind that opened with a breath, but the heavy emergency bay doors that only moved when someone hit them hard with both hands. 2 soldiers came through first, then a third cradling something wrapped in a tactical vest stained dark at the edges. She registered the military patches before she registered anything else. Canadian Forces. 8-Wing Trenton. Then she saw the dog. He was a Belgian Malinois, lean and long-muscled, wearing a vest of his own, olive drab with a maple leaf patch on the shoulder. One of his front legs hung wrong. His breathing came in shallow pulls, the kind Lena recognized from 12-hour shifts in the ICU, the kind that meant the body was deciding whether to keep trying. "He needs help," the soldier closest to her said. His name tag read Calloway. His voice was steady in the way that men trained not to panic kept their voices steady, which is to say, barely. Lena was already moving. She didn't think about protocol. She didn't think about the fact that Briar Ridge General was not, in any official capacity, a veterinary facility. She pulled a gurney from the trauma bay, grabbed a pressure cuff she knew wouldn't fit, but would have to, and called back over her shoulder for Tomas, the only other nurse on her side of the ward that hour, to get her a saline line and something she could use to clean a wound. "What happened?" she asked Calloway. "Training exercise gone wrong. Ravine. He went down trying to locate a simulated casualty. Legs broken, we think, and he's been losing blood for 40 minutes. He paused. "His name is Reaper." "Reaper," she repeated, not because she needed to know, but because she thought he might need to hear her say it. Like she understood who they were talking about. She had the vest off him gently, working around the injury. Reaper didn't snap at her. He watched her with dark, alert eyes, panting fast, and she talked to him the whole time in the low, even voice she used for her most frightened patients. She was 3 minutes into her assessment when Director Holt walked in. Vivian Holt was the kind of administrator who arrived at a scene the way a cold front arrived. You felt the pressure change before you saw her. She was 51, precise in her movements, the type who had never once been late to anything in her professional life and considered that a virtue rather than a symptom. She stood in the doorway of the trauma bay with her arms crossed and took in the scene. A Belgian Malinois military dog on a gurney, an IV line being prepped, and one of her ICU nurses kneeling on the floor to get a better angle on a leg wound. "Marsh." Lena didn't look up. "Give me a minute. I need you to stop what you're doing." Tomas had gone very still beside her. He was 26, and this was his 2nd year. He looked at Lena the way junior staff always looked at senior nurses when authority walked in, waiting to see who would move first. Lena finished wrapping the wound before she stood. "Director Holt," she said, "he's a military working dog. He's hemorrhaging. I've stabilized the bleed, and I'm going to get him to a point where he can be safely transported to an actual veterinary trauma unit." "You are not a veterinarian," Holt said. "I know what hemorrhagic shock looks like regardless of the species." Holt's jaw tightened. "This facility is not equipped, insured, or authorized to treat animals. You know this. I know that there's a living thing in front of me that will die if no one acts in the next 20 minutes. The soldiers had said nothing during this exchange. Calloway stood near the door watching. There was a younger one behind him. Couldn't have been more than 22, with the red-rimmed eyes of someone who had been trying very hard not to show what he felt. He was Reaper's handler. Lena had figured that out within the first 30 seconds, the way the dog's eyes kept finding him, even from the gurney. "Marsh," Holt said again. And now her voice had the particular quality Lena had heard used on her exactly once before, 3 years ago, when she had pushed back on a patient discharge she disagreed with. "Step away from the animal." Lena looked at her for a long moment. Then she looked at Reaper, who was still watching her, still breathing in those shallow pulls. She stepped back to the gurney. "I'm not going to do that," she said. The room was very quiet. Even the monitor seemed to hold. Holt said, "Then I need you to hand over your badge." Lena reached up to the lanyard around her neck without looking away from her patient. She unclipped the badge, held it out to the side, and set it on the edge of the counter. Then she turned back and finished preparing the IV site. Tomas handed her the line without being asked. She heard Holt make a phone call. She heard words like security and escort and immediate effect. She kept working. She got the line in on the first try, which she was grateful for because her hands had started to shake slightly and she needed them to cooperate. Reaper's handler moved closer while she worked. He stood at the head of the gurney and put his hand near Reaper's muzzle, not holding him down, just letting him know he was there. His name, she learned later, was Private First Class Gagnon. He was 23 years old. He had been partnered with Reaper for 14 months. "Is he going to make it?" Gagnon asked. "I don't know," she said, "but he has a better chance now than he did 10 minutes ago." Security arrived 8 minutes later. 2 of them older guys, Rick and somebody whose name she never got. Rick looked at the scene, looked at Holt, looked at Lena, and had the expression of a man who deeply wished he were somewhere else. "Ms. Marsh," he said carefully, "Director Holt has asked me to escort you out of the building." "I know," Lena said. "Give me 2 minutes." She talked Tomas through everything. Drip rate, wound check schedule, what to watch for in the breathing, who to call at the Trenton Veterinary Emergency Line, whose number she pulled from her phone and wrote on the back of a supply requisition form. She told him to keep Gagnon close, that the dog would do better with a handler nearby, and to not let anyone disconnect the line without a good clinical reason. Tomas nodded at everything she said. He was pale but steady. She picked up her phone. Her jacket was in her locker on the 3rd floor. She had $40 in cash, her keys, and her transit card in her scrub pocket, which she only knew because she had the habit of patting her pockets before every shift the way some people patted their pockets before leaving the house. Rick walked with her, not unkindly. They didn't go through the main lobby. Holt had apparently arranged for a side exit, which Lena thought said something about the director's awareness of optics, at least. The night was cold. It was March in eastern Ontario, the kind of March that I'd forgotten it was supposed to be trending towards spring. She stood on the sidewalk outside the staff entrance and looked at the parking lot and thought, with a clarity that surprised her, that she had just done the only thing she could have done. She called her sister. Bridget answered on the second ring, half asleep, and Lena said, "I got fired," and then stood there listening to her sister go from confused to awake to furious in under 30 seconds, which was honestly a comfort. "Come here," Bridget said. "Right now. I'll put the kettle on." "I don't want tea." "I know. I'll put something else on. Come." She took the bus. It was just past midnight, and the 62 was running every half hour, and she sat in the back and stared at her hands, which had finally stopped shaking, and thought about Reaper's breathing and whether Tomas would remember to keep checking the pressure site. She thought about the look on Gagnon's face when she'd said she didn't know if he would make it. She thought about the look on his face the moment before, when she'd said, "But he has a better chance." She didn't sleep much that night. Bridget's apartment was small and warm and smelled like whatever she had cooked for dinner, and hadn't fully cleaned up yet. She made Lena sit on the couch and brought her a blanket and something that was not tea and was approximately 40% stronger than what Lena would normally have on a weekday, and Lena accepted it without comment. "You're going to fight this," Bridget said. "I don't know." "You treated a military working dog who was going to die. They fired you for it. You're going to fight this." "It's more complicated than that." "It really isn't," Bridget said. Lena pulled the blanket tighter. She wasn't wrong, technically. It's not a veterinary hospital. The liability exposure alone. "Lena." "What?" "You saved a dog that helps keep people alive. The technical liability argument is going to land very well with the public, I promise." She fell asleep on her sister's couch around 2 in the morning and woke to her phone full of texts from Tomas. The first one was from just after she'd left. "Reaper is stable. Vet transport is on the way." The second was from an hour later. Transport arrived. "Gagnon went with him. He asked me to tell you thank you." The third was from this morning, Lena. "You need to see the news." She sat up and pulled up the local Belleville station's website. The headline was not subtle. "Veteran, nurse fired for no cancelled, and Degenerate military dog. Canadian Forches respond." There was a video. She watched it with the blanket still around her shoulders, Bridget reading over her arm, both of them silent. It had started with Callaway. He had gone back to the base and filed a report as he was required to do. And the report had gone up the chain the way reports did, and somewhere in that chain it had reached someone who had felt very strongly that Briar Ridge General's director of operations needed to be spoken to. That was the official version. The unofficial version, which came out in pieces over the following days, was that Reaper was not just any military working dog. He was 8 years old, a veteran of 2 overseas deployments, and had been awarded a unit citation for locating a buried casualty during a training collapse exercise in 2023 that had saved 2 soldiers' lives. He was 3 months from retirement. His handler, Ganyan, had applied to adopt him. The forces had sent people to the hospital by 8 o'clock that morning. Not to storm it exactly, nothing that dramatic. But 3 senior officers in full dress uniform walking through the front doors of Briar Ridge General at 8:04 a.m. asking to speak with the director had approximately the effect you would expect. Holtz met them in the boardroom. Lena was not there for that conversation. She heard about it afterward, through channels she would not be asked to explain, and what she heard was that the officers had been polite, precise, and completely clear. The Canadian forces took the welfare of their working animals seriously. They took the treatment of those animals by civilian personnel, particularly personnel who acted at personal professional cost, seriously as well. They were not there to make demands. They were there to ensure that the relevant parties understood the full picture. The full picture, as understood by the base's legal liaison and subsequently communicated to Briar Ridge's board, included the detail that Lena Marsh had completed 2 years of pre-veterinary studies before switching to nursing, had treated the animal within a reasonable standard of emergency care, had taken no compensation and accepted no liability on behalf of the hospital, and had done everything in her power to arrange a proper transfer of care before she was removed from the building. The board met at noon. Holt's version of events, Lena was told, did not survive contact with the full sequence of facts. She got the call at 2:17 in the afternoon. A board member named Dr. Sinclair, whom she had met once at a hospital fundraiser and who had the careful voice of someone accustomed to managing situations that had gotten away from other people, he told her that her termination had been reviewed and reversed. He told her that the hospital would be reviewing its emergency protocols. He told her that she was welcome to return to work at her earliest convenience, and that her accumulated sick leave and benefits had not been affected. She thanked him, hung up, and sat in Bridget's kitchen for a while. "Well," Bridget said from the doorway, "they gave me my job back." Bridget made a sound that was something between satisfaction and vindication, obviously. "They said at your earliest convenience, which means they're hoping you come back tomorrow." "Which means they're hoping I come back tomorrow," Lena agreed. She went back on Thursday. Her badge had been reprinted. Same photo, same number, just a new one. Rick from security held the door for her when she came in and said, "Good to see you, Ms. Marsh," with the air of a man who had done some reflecting. Tomas met her at the elevator and handed her a coffee and said nothing, because nothing was required. The unit had made her a card. It was the kind that everyone signs and someone is always responsible for, and it ends up being a strange collection of handwriting styles and earnest messages, and 1 or 2 people who will always write something a little bit sideways. She read it in the break room and was surprised to find that it made her eyes sting. Holt was not there that week, or the week after. She was not there the week after that either. The new interim director was a quiet man named Dr. Beaumont, who had the look of someone who had agreed to step in temporarily and was already reconsidering it, but who was also, from everything Lena could tell, genuinely trying to understand how the department actually worked, rather than how it appeared to work from an administrative distance. She decided provisionally to give him a fair chance. She heard about Reaper through Gagnon, who sent a message through Tomas because Lena had no way to contact him directly. The veterinary team at CFB Kingston had assessed the break and operated the same day she'd stabilized him. The leg would heal. He would be fine. His retirement date had been confirmed, June 14th. Gagnon's adoption application had been approved. She read the message, standing at the nurse's station between patients, and felt something settle in her chest that had been tightened for days. A colleague passing by, Raina, who had been a nurse for 20 years and had seen most things, glanced at her face and said, "Good news." "Yeah," Lena said, "good news." Raina nodded and kept walking, because 20 years teaches you when someone needs a moment and when they need a question. And this was clearly a moment. Lena tucked her phone back in her pocket and picked up the next chart. There was a lot of work to do, and she had been away for 2 days, and this unit ran better when she was in it. She knew that not as vanity, but as simple operational fact. The same way she knew the drip rates and the discharge protocols and where the night charge nurse kept the good pens. She clipped her badge to her lanyard. She walked back onto the floor. Somewhere 3 hours east of her, a Belgian Malinois with a maple leaf patch on his vest was sleeping off surgery in a veterinary recovery unit, with the particular piece of an animal who has been through something hard and come out the other side, and who would spend his retirement years in a house with a yard and a young man who knew exactly how lucky he was. Lena didn't know that part yet. She would, eventually. But right now, there was a patient in room 7 whose labs had just come back, and a family in the waiting room who needed someone to talk to them plainly and kindly, and a ward that had kept running without her, but ran better with her in it. She had work to do. She went and did it. I keep coming back to the moment Lena set her badge on the counter. Not threw it. Not slammed it. Just set it down, quietly, and turned back to her patient. That one gesture has stayed with me more than anything else in this story because it tells you everything about who she was before any of this happened and who she remained after. There's something we don't talk about enough when we talk about doing the right thing. We frame it like a decision, like someone weighs the options and chooses correctly, but I don't think that's how it actually works for people like Lena. I think for her, in that moment, there wasn't really a choice to make. There was just what needed to be done, and the question of whether she had the spine to do it. She did, and she paid for it immediately the way people who act on principle often do. Not later, not symbolically, but right then, in the cold, without her jacket, waiting for a bus at midnight. What I find myself thinking about is the knowledge she carried into that trauma bay. 2 years of pre-veterinary studies before she switched to nursing. She didn't abandon that. She held on to it quietly, the way people hold on to things that matter to them even when those things don't fit neatly into a job title. When Reaper came through those doors, she wasn't just a nurse making a judgment call. She was someone who had spent years learning exactly this, who happened to be standing in exactly the right place. That's not luck. That's what happens when a person keeps developing, keeps building on what they know, even when no one's asking them to. And then there's Holt, who had all the authority in the room and used it to make the worst possible decision. I don't think Holt was a monster. I think she was a person who had spent so long managing risk on paper that she forgot there was a living thing on the floor in front of her. That's its own kind of failure. Not dramatic, not villainous, just a slow narrowing of what you're willing to see. The consequences came, and they came because the world around her could see what she couldn't. That's the part that feels true to me. Not that good people are always rewarded and bad decisions always punished. That would be a nicer story than the one we actually live in. But that integrity tends to be visible. The officers who walked into Briar Ridge that morning weren't there because the universe course corrected. They were there because Calloway filed a report, because Gagnon told someone what had happened, because a chain of people who cared about something larger than their own inconvenience decided to make it matter. Lena held the line. Others carried it forward. That's how it actually works. I think about Private First Class Gagnon, 23 years old, standing at the head of that gurney with his hand near Reaper's muzzle. Not restraining him. Just being there. Sometimes that's the whole job. Just being present for someone who's frightened, letting them know they're not alone. Lena understood that. She talked to Reaper the whole time she worked. She knew that steadiness is its own form of care. She went back on Thursday, put the new badge to her lanyard, and walked back onto the floor. No speech, no vindication moment, no pause at the doorway for effect. Just work. Because there were patients who needed her and a ward that ran better when she was in it. That's the version of integrity I believe in. Not the kind that announces itself. The kind that just keeps showing up,